Here is a fresh rewritten version of your script. I changed wording, structure, flow, and phrasing so it reads like a new original script. While keeping the same topic and educational value, 4 common seeds could be working against your heart, your medications, and even your memory. And most people over 60 eat them thinking they are doing something healthy. But here's the surprising part. There are also 4 simple seeds that can protect your heart, support your brain, and reduce inflammation as you age. And choosing the right ones can make a bigger difference than you might expect. For years, we've heard the same advice. Seeds are natural, anti-inflammatory, and good for your heart. And in many cases, that's true. But what almost no one explains is that the body of a 60 or 70-year-old processes certain foods very differently than it did at 40. As we age, the liver doesn't detoxify as efficiently as it once did. The kidneys filter the blood more slowly. Inflammation tends to stay active longer. Because of these changes, some compounds inside everyday seeds can gradually build up in the body and begin creating problems instead of preventing them. The most concerning part is that it happens quietly. You won't suddenly feel it after eating a handful of seeds. Instead, the effects show up slowly. Your blood pressure numbers begin creeping higher even though you're taking medication. Your joints feel more stiff in the morning. You wake up tired even after a full night of sleep. Your memory might feel a little slower than it used to. Digestion becomes unpredictable. If any of those sound familiar, you're not alone. I hear these exact concerns from patients all the time. And many people blame aging itself when the real cause is hiding somewhere much simpler, in the foods they eat every day. My name is Dr. Michael Kent. I practiced internal medicine for more than 3 decades, and one thing has always concerned me. Most people never receive this kind of practical nutrition information. During a short doctor's appointment, there simply isn't enough time to explain which foods may interact with blood pressure medications, cholesterol drugs, or blood thinners. Food labels don't warn you either. And most online health articles are written for younger adults, not for people in their 60s, 70s, or beyond. That information gap is exactly why I wanted to create this video. Before we continue, I'd like to ask you something. If you've ever felt like you're doing everything right for your health but still don't feel your best, type me too in the comments below. I read the comments carefully, and hearing from you helps guide future videos. Now here's the encouraging news. For every seed that may create problems for an aging body, there is another seed that can support your heart, calm inflammation, and even help your medications work more effectively. Let's begin with the seeds that can truly support your health after 60. Number 4 on the list is one that surprises many people: flax seeds. When most people think about omega-3 fats, they immediately think about fish, salmon, sardines, or fish oil capsules. And those are excellent sources, but many older adults don't eat fish regularly, and some cannot tolerate fish oil supplements. Flax seeds provide a powerful plant-based omega-3 fat called ALA. This nutrient helps calm the low-grade inflammation that contributes to heart disease, joint discomfort, cognitive decline, and stiff arteries. Inflammation of this kind develops slowly over many years. You don't feel it happening day to day, but over time it can affect many areas of health. Flax seeds also contain plant compounds called lignans. These compounds have been studied for their protective effects on both cardiovascular health and hormone balance. Another advantage is the soluble fiber found in flax seeds. This type of fiber slows the absorption of sugar into the bloodstream, which helps stabilize blood glucose levels, something especially important for people managing prediabetes or type 2 diabetes. But there is one important detail many people overlook. Flax seeds should be eaten ground, not whole. Whole flax seeds often pass through the digestive system without being broken down, meaning the body absorbs very little of their nutrition. Ground flax seeds allow your body to access the beneficial fats and fiber. A simple routine works best. Add 1 tablespoon of ground flax seed to oatmeal, yogurt, or a smoothie in the morning. Store it in the refrigerator after opening because the natural oils can spoil if left at room temperature. 1 tablespoon per day is enough to provide meaningful benefits. It's simple, affordable, and easy to add to foods you already eat. Now let's move to number 3, pumpkin seeds. These may be one of the most overlooked nutritional foods for adults over 60. Yet the nutrients inside pumpkin seeds directly address several common concerns that appear with aging. First, sleep. Many people notice that their sleep becomes lighter and more irregular later in life. Part of the reason is that the body produces less melatonin with age. Pumpkin seeds naturally contain tryptophan, an amino acid that the body converts into serotonin and eventually into melatonin. A small handful of pumpkin seeds in the evening can support the body's own sleep-regulating system without relying on supplements. For men, pumpkin seeds also provide nutrients that support prostate health. They contain zinc and plant sterols that have been associated with improvements in symptoms related to prostate enlargement, including nighttime urination. For women, pumpkin seeds are an excellent source of magnesium. Magnesium plays an important role in maintaining bone strength, regulating muscle function, and supporting healthy blood pressure levels. Unfortunately, magnesium deficiency is quite common in older adults. Food sources like pumpkin seeds allow the body to absorb magnesium gradually and gently, often avoiding the digestive discomfort that some supplements can cause. A simple portion works well, about 1 ounce, roughly a small handful, of raw, unsalted pumpkin seeds each day. They can be eaten as a snack sprinkled onto salads or added to soups. Try to avoid heavily salted packaged versions since excess sodium can counteract the cardiovascular benefits. Sleep support, prostate health, bone strength, and blood pressure balance, all from a single small food. Next is number 2, sesame seeds. Most people believe strong bones depend primarily on dairy products. Milk, cheese, and yogurt certainly contain calcium, but sesame seeds offer something unique. Just 1 tablespoon provides a remarkable amount of calcium, along with magnesium and zinc. Those additional minerals are essential because calcium alone cannot build strong bones effectively. Magnesium and zinc help guide calcium into bone tissue where it belongs. Without them, calcium can sometimes accumulate in the arteries instead, contributing to calcification. Sesame seeds naturally deliver these nutrients together in a balanced form. They also contain a unique compound called sesamin. Research suggests that sesamin may help relax blood vessels and support healthy blood pressure levels. For people already managing hypertension, foods like sesame seeds can complement other healthy habits and medical treatments. Sprinkling a tablespoon of sesame seeds onto vegetables, salads, or rice dishes is a simple way to include them regularly. Small habits like these often add up to meaningful improvements over time. These nutrients help protect the delicate membranes that surround brain cells from the oxidative stress that builds up with age, a process strongly linked to gradual memory decline. One of the easiest ways to include sesame in your diet is through tahini, a smooth paste made from ground sesame seeds. Spread a spoonful on whole grain toast, blend it into a salad dressing, or stir it into soups and sauces. The flavor is mild, but the nutritional impact is powerful. A good goal is about 2 tablespoons per day. For better absorption, choose hulled sesame seeds or tahini. The outer shell of unhulled seeds can be difficult for an older digestive system to break down, meaning your body may not access all the nutrients inside. If you're dealing with both blood pressure concerns and bone density loss, something very common after 60, sesame seeds are quietly one of the most supportive foods you can add to your daily routine. 2 tablespoons, simple and effective. Now let's talk about the number 1 seed on this list, and the one that surprises almost everyone when they hear it, pomegranate seeds. When people hear the word seed, they usually imagine something dry and crunchy from a bag or jar. Pomegranate seeds are different. Those bright ruby-colored jewels inside a pomegranate are actually among the most powerful plant foods studied in cardiovascular and brain health. Inside these seeds are unique compounds called punicolagens, which are found almost exclusively in pomegranates. Researchers have discovered that these compounds help reduce inflammation directly within the lining of the arteries. They also help prevent LDL cholesterol from becoming oxidized, a chemical change that turns ordinary cholesterol into something far more damaging to blood vessels. In other words, they help stop the process that leads to plaque buildup. One well-known clinical study followed individuals with diagnosed coronary artery disease who consumed pomegranate regularly. After 1 year, researchers observed something remarkable. Instead of plaque continuing to grow inside the arteries, many participants experienced actual reductions in plaque thickness. That means the process had not only slowed, in some cases it had begun to reverse, but the benefits don't stop with the heart. Pomegranate polyphenols are able to cross the blood-brain barrier, something many antioxidants cannot do. Once inside the brain, they help calm the inflammation associated with cognitive decline and neurodegenerative diseases. In one clinical trial involving older adults, participants who consumed pomegranate daily showed measurable improvements in both verbal and visual memory tests in just 4 weeks. 4 weeks. That kind of result is rarely seen from a simple food. Now, there is one important note if you take cholesterol medications. Pomegranate may influence the same liver enzyme system that processes certain statin drugs in a way similar to grapefruit. This doesn't mean you should avoid pomegranate entirely. It simply means it's wise to mention it to your doctor so they can keep an eye on your medication levels. That brief conversation ensures everything continues to work safely while you still benefit from the fruit. Fresh pomegranate seeds are the best option. A small bowl each day works well. When the fruit isn't in season, 100% pomegranate juice with no added sugar can offer similar benefits. Try to avoid capsules or supplements claiming to replace the fruit. Most of the research has been done using the whole food itself. Reduced artery inflammation, better circulation, sharper memory in just weeks. If you choose only one addition from today's video, pomegranate seeds would be an excellent place to start. Now, in the first half of this video, we focused on seeds that can genuinely support your health as you age. But there's another side of the story that's just as important, because some seeds, especially the way they're processed today, may quietly work against your health. Not because they are poisonous or inherently dangerous, but because of how they interact with aging metabolism and with common medications many adults over 60 are already taking. These are the seeds I encourage my patients to reconsider. Let's start with number 4. Commercially roasted sunflower seeds. This one surprises people because sunflower seeds are widely promoted as a healthy snack. And to be fair, raw sunflower seeds themselves are nutritious. The issue is not the seed, it's the way most packaged versions are processed. Commercially roasted sunflower seeds are frequently cooked at extremely high temperatures in industrial seed oils. These oils are exposed to heat and oxygen during processing, which can lead to the formation of unstable fats known as oxidized lipids. When consumed regularly, these damaged fats can contribute to inflammation and oxidative stress inside the body. And for an aging cardiovascular system that is already under pressure, that's the opposite of what we want. Many packaged sunflower seed snacks are also heavily salted. High sodium intake can quietly push blood pressure higher, especially for individuals who are already managing hypertension. The better option if you enjoy sunflower seeds is simple. Choose raw or lightly dry roasted, unsalted seeds and keep portions moderate. That way you receive the nutritional benefits without the added stress on your heart and blood vessels. Many of the oils used to roast packaged sunflower seeds have already been exposed to heat, light, and oxygen long before the seeds even reach the factory. By the time those oils coat the seeds and go through another round of high-temperature roasting, the fats have often become oxidized. That matters because oxidized fats behave very differently in the body than fresh, stable fats. Instead of supporting health, they can trigger inflammatory reactions, particularly inside the lining of blood vessels. For someone over 60, that detail becomes especially important. Chronic inflammation in the arterial wall is one of the key drivers behind atherosclerosis, the process that gradually leads to plaque buildup inside arteries. This inflammation is silent. You won't feel it day to day, but over time it contributes to stiffened arteries, rising blood pressure, and increased cardiovascular risk. Researchers studying aging and cardiovascular health have pointed out that repeatedly heated refined oils can contribute to this inflammatory cycle. And there's another issue hiding in many bags of roasted sunflower seeds: sodium. Many commercial varieties contain 300 milligrams of sodium or more per serving. For anyone already trying to manage blood pressure, that amount of sodium quickly adds up and may counteract the benefits you expected from the seeds in the first place. Now, to be clear, sunflower seeds themselves are not the problem. The processing is. If you enjoy sunflower seeds, the better choice is simple. Look for raw, unsalted sunflower seeds. A small 1-ounce serving provides valuable nutrients like vitamin E, magnesium, and selenium, all without the damaged fats or excessive salt. When you're shopping, take a quick look at the label. If it says roasted in oil, it may be better to leave that package on the shelf. Again, the seed is not the issue, it's the way it was prepared. Now let's move to number 3, chia seeds. This one connects directly to something I mentioned earlier in the video. Chia seeds can absolutely be beneficial for older adults, but when they're used incorrectly, they can create 2 very real problems that many people are never warned about. The first issue involves swallowing. Dry chia seeds absorb moisture extremely quickly. When they come into contact with liquid, they expand and form a gel-like coating. If someone eats them dry and they begin absorbing moisture in the throat or esophagus, they can swell before reaching the stomach. For individuals who already have difficulty swallowing, something that becomes more common with age and especially after a stroke or neurological condition, this can create a blockage in the esophagus. Medical case reports have documented situations where emergency treatment was required to remove swollen chia seeds lodged in the throat. It's not common, but it's real. The second concern involves blood pressure. Chia seeds can help lower blood pressure, which is normally a positive effect. But if someone is already taking medication to reduce blood pressure, the combination can sometimes push pressure lower than intended. For older adults who occasionally feel lightheaded when standing up, a condition called orthostatic hypotension, that extra drop in blood pressure can increase the risk of dizziness or falls, and falls remain one of the leading causes of serious injury among adults over 65. The solution is simple and easy. Always soak chia seeds before eating them. Mix about 2 tablespoons into water, yogurt, or another liquid and allow them to sit for at least 20 minutes. This allows the gel to form safely before consumption, and if you plan to add chia seeds regularly to your routine, it's wise to mention it to your doctor, especially if you're taking blood pressure medication. Again, the seed itself isn't the enemy. The issue is how it's used. Now let's move to number 2, flax seeds, when eaten in excessive amounts. Earlier in this video, I recommended flax seeds as one of the most helpful seeds for adults over 60. That recommendation still stands. But flax seeds are also a good example of how more is not always better. At the right amount, flax seeds support heart health and reduce inflammation. At very high amounts, they may create complications for certain individuals. 1 tablespoon of ground flaxseed per day is generally considered beneficial. Problems tend to appear when people begin consuming 3, 4, or even 5 tablespoons daily, which some internet health guides surprisingly recommend. Flax seeds contain plant compounds called lignans that behave somewhat like mild estrogens in the body. At moderate levels, this can be helpful, particularly for women after menopause. But at very high levels, people with a history of hormone-sensitive cancers, such as certain types of breast, uterine, or ovarian cancer, should speak with their doctor before consuming large quantities. There's another interaction many people don't realize. Flax seeds can enhance the effects of medications that lower blood sugar. For individuals taking drugs like metformin or insulin, large amounts of flaxseed may intensify the glucose-lowering effect. The American Diabetes Association has noted that older adults are sometimes less able to recognize early warning signs of low blood sugar. Because of that, moderation becomes especially important. For most people, 1 tablespoon of ground flaxseed per day provides the benefits without introducing unnecessary risk. Nutrition often works best in balanced amounts. Even healthy foods can become problematic when taken too far. After the age of 60, the body often becomes less sensitive to the early warning signs of low blood sugar. That means glucose levels can fall lower than they should before you notice something is wrong. For that reason, moderation with flax seeds is important. 1 to 2 tablespoons per day is both the safe range and the beneficial range for most people. More than that does not add extra benefit, and in some situations, it may create unnecessary risk. If you are taking medication to control blood sugar, it's wise to simply mention your flaxseed intake during your next doctor's visit. It's a quick conversation, but it helps ensure everything stays balanced. Now we arrive at the final item, the one that likely affects more people over 60 than anything else discussed today, and ironically, it's not something most people even recognize as a seed product: refined seed oils. You won't find these sitting in a bowl on the table. Instead, they are hidden inside a large number of packaged foods: canola oil, soybean oil, corn oil, cottonseed oil, and the catch-all term you'll often see on ingredient lists: vegetable oil. These oils come from seeds, but they are produced through a heavy industrial process that involves high temperatures and chemical extraction. During that process, the natural structure of the oil changes significantly. The final product often contains a very high ratio of omega-6 fats compared to omega-3 fats, along with fats that have already been oxidized during processing. Inside the body, those oxidized fats can contribute to low-grade inflammation within blood vessel walls. It's not the type of inflammation you can feel. It's subtle, gradual, and long-term, but over many years it plays a role in the development of arterial plaque and cardiovascular disease. What makes this especially concerning is how common these oils have become. They appear in salad dressings marketed as heart-healthy. They are used in crackers, sauces, snack foods, and many restaurant meals. Most people believe they are making responsible food choices. yet they are consuming refined seed oils several times a day without realizing it. There is another angle that receives far less attention. Diets extremely high in omega-6 fats may influence how the body processes certain medications. Some research has suggested that an excessive omega-6 intake can compete with the metabolic pathways used by anti-inflammatory drugs and some cardiovascular medications. In simple terms, the effectiveness of certain medications may be influenced by the types of fats consistently present in the diet. Now, this does not mean you should panic about every drop of oil in your kitchen, but it does suggest that a simple change can make a meaningful difference. Instead of cooking regularly with generic vegetable oil or refined seed oils, consider switching to extra virgin olive oil for low to moderate heat cooking. For higher heat, avocado oil is another stable option. That single swap may be one of the most impactful nutrition adjustments you make this year, because sometimes the ingredient we never think about is the one affecting us the most. Now let's pause for a moment. If you watched this entire video, that tells me something important about you. You are paying attention to your health. In my years practicing medicine, the patients who remained active, mentally sharp, and independent the longest were not necessarily the ones with perfect genetics. They were the ones who stayed slow and continued making small, thoughtful changes. Your body still responds to what you give it. Your heart, brain, bones, and energy levels are influenced by your daily choices, even after 60. In many ways, those choices matter more now than they did decades ago. Aging is not a fixed outcome, it's a direction, and directions can change. So instead of leaving you with a complicated plan, here are 3 simple takeaways from today's video. First, consider adding ground flax seeds, pomegranate seeds, or both to something you already eat in the morning. Second, replace refined vegetable oils in your kitchen with olive oil or avocado oil. And third, if you take medications for blood pressure, cholesterol, blood sugar, or blood thinning, bring up these dietary changes during your next appointment. Just a short conversation can make sure everything works together safely. These are small adjustments, but 6 months from now, your body may feel the difference. Before we finish, I'd love to hear from you. Are any of the seeds we discussed today already part of your routine? Have you noticed changes in your energy, sleep, digestion, or overall health? Share your experience in the comments. Your story might help someone else make a better decision for their health. And if you found this video helpful, please take a moment to like it so the platform shares it with more people who could benefit from this information. You can also share it with a friend or family member who cares about their health. And if you haven't already, consider subscribing to the channel. Every week I share research-based insights focused on helping adults stay strong, independent, and informed as they age. Remember this, getting older does not automatically mean losing strength or vitality. Often it simply means we haven't been given the right information yet. Now you have some of it, and information becomes powerful when it leads to action. Take good care of yourself. You deserve it.